Hi, everybody. Thank you so much for having me here today. As Tess mentioned, my name is Melanie O'Loughlin. I'm a genetic counselor at the Hereditary Cancer Program. And today we'll be talking about BRCA in the family. So just to start, I'd like to respectfully acknowledge that I live and work on the traditional, ancestral, and unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm joining today from my office at BC Cancer in Vancouver. So a brief outline of what I'm planning to talk about today. So starting with a quick review about BRCA and inheritance, just to lay the foundation and make sure we're all on the same page about why is it important to share this information with relatives. We'll chat briefly about talking with adult relatives, including some resources to support the information sharing, and then focus most of our time on talking with children or young people about hereditary cancer. Okay, so a bit of background information. I like to think of the genetic code as the instruction manual for the body, with BRCA 1 and 2 being genes that are part of that instruction manual telling the body how to protect from certain cancers, such as breast and ovarian cancer. So BRCA 1 and 2 are genes that we all have, and some people have a mutation or a spelling mistake in the gene. When there is a spelling mistake or mutation, that means that the body can't read that particular instruction. So in this case, read the instruction about protecting from certain cancers, and that's what causes that higher chance. So a little bit of a simplified version of what's going on, but that's sort of the general idea. So those spelling mistakes or typos are often called mutations. You may come across the term pathogenic variant, which is the most sort of up-to-date term in the scientific literature. You'll probably hear me talking about carrying the gene during the presentation today, and as we've discussed just now, that's not technically correct because we all carry the gene, and what we're really talking about is carrying a gene mutation. But that is the way most people talk about it in everyday life, so you will likely hear me referring to it in that way. So BRCA 1 and 2 mutations are inherited in families in a way that's called autosomal dominant inheritance. Not particularly important to remember that exact term, but what we mean by that is that if a parent carries the gene mutation, there is a 50-50 chance for that to be passed on from a parent to a child. And that's a random chance. So it's like flipping a coin for each child. You could get 3 heads in a row and all 3 children in the family inherit the gene. You could get 3 tails in a row and none of them inherit it, or it could be a bit of a mix of both. The inheritance does not relate to biological sex, so it can be carried by both males and females. It can come down from mom's side or dad's side. It doesn't relate to looking more like one parent or the other. So if a child, looks just like dad and dad carries the gene, that doesn't tell us actually whether they carry the gene or not. And also doesn't relate to birth order in the family. A question that commonly comes up is, can the gene skip generations? And the answer is no. So if a parent does not carry the gene, if they've tested negative for the gene, it's not possible for them to then pass that on to their children. So with the background out of the way, sort of moving on to the information discussion for today, starting with the beginning. Why should I talk to my family members about hereditary cancer? I expect many of you probably have your own answer to this question that you may be thinking about, but just to cover it explicitly, carrying a BRCA 1 or 2 mutation causes an increased chance for certain cancers. And when people know about that chance, they can access services to reduce their risk or to catch something as early as possible. So we encourage telling family members because they could also have the gene, and if they know that, they can access screening or prevention. So going on to who should I tell this information to? So as we've just chatted about, both males and females can carry the gene. So it is relevant to tell both male and female relatives. We often think about breast and ovarian cancer with these genes, which is understandable. That's where the highest chance for cancer sort of sits with BRCA 1 and 2. But there are implications for male carriers as well, for example, for prostate screening. Beyond this, who should I tell? The short answer to that question is really as many people as possible in the family, or as many people as you're comfortable with. The longer answer to that question is that the people that are most closely related to you have the highest chance to also carry the gene, and it goes down from there. So in a perfect world, we might test people in a stepwise way in the family to narrow down who's at risk. So for example, if we know that this person carries the gene alteration, we might suggest starting with their parents to see which side of the family it comes from, to clarify who's at risk in the family. And then really focus our efforts, or focus the information sharing with that side of the family. But we all know that real life doesn't necessarily work that way. And sometimes there may be all kinds of reasons why the testing doesn't happen in that order. Maybe the closest genetic relatives don't want to have the test. They might not come forward in the time frame that we want. There may be that the intervening relatives have passed away, or there might be all kinds of reasons that the testing doesn't happen that way. So at the Hereditary Cancer Program, we will offer genetic testing to more distant relatives as they come forward for testing. So for example, if this person is known to carry the gene and the first relative that comes to see us is their cousin over here, we would offer them the genetic test to get started. We know most people have intentions to talk to their family about the genetic risk, and when we asked gene carriers at our clinic if they have spoken to relatives about the gene, 97% of those who responded to the survey said yes. But that doesn't mean that all family members are aware. And when we looked a bit closer at that 97%, siblings were the most likely to be having conversations with each other about the gene, and more distant relatives were less likely to be talking with each other about it. So there is a bit of a concern that the news may not be getting out as wide as it could in families. And there was a study at the Hereditary Cancer Program in 2020 that showed for people with a hereditary colon cancer gene alteration, 33% of their first-degree relatives actually came forward to have the genetic test. So for a person, if we imagine a person that has that hereditary colon cancer gene, if they had 3 siblings, one of their siblings was coming forward to have the genetic test. So that's a lot of missed opportunity for prevention and early detection, and not as many people are accessing the testing that could. We know it can be complicated to discuss this with relatives. We also know that not knowing is not the only reason why they might not be coming forward. I do hear from a lot of people that I've told my family, but they haven't taken that next step. So there's multiple reasons why not everybody's having a genetic test. But we do want to encourage people to get the word out so that the people that are eligible for this testing are aware of that option. We know it can be complicated and sometimes challenging to talk about it. Some families aren't close, maybe they don't talk about health issues, and all families are different. So if you are in touch with, for example, a second cousin or somebody a bit more distant, we do encourage you to let them know. And if a relative were to contact us and say, to connect about the genetic test, and we were able to determine that actually they're not at risk, or we're aware of some testing in the family that shows us that they're not at risk of the gene, we would be able to tell them at that time. So to support that information sharing, there are some tools and resources out there. One being a family letter from the Hereditary Cancer Program. So the Hereditary Program often provides a one-page information sheet that's something to the effect of, there is a gene in your family, a little bit about the gene, and you are eligible for a genetic test, and contact us to find out more, that type of thing. If you would like a copy of this, you can reach out. We're happy to provide a copy of that if that sounds useful. There are also websites that can generate this kind of letter to pass on to relatives. So I've shared one here. So basically with this tool, you can input your name, your relative's name, the name of the gene, and I think a couple of other details, and it will generate a page that you can share with your relative to let them know. The next two websites are to find local services for your family members. So for anybody here in BC or in Yukon, we're their contacts, so they can reach out to the Hereditary Cancer Program to talk about options for testing and to find out more. But for people around Canada, this first one might be useful. It's the Canadian Association of Genetic Counsellors website to search for local genetics clinics. This one here is the National Society of Genetic Counselors, which is the American organization. So if you have relatives in the US, this is a helpful site to find services near them. You can also reach out to us and we can help find a clinic near your family. That would be useful. And as mentioned, for relatives here in BC, they can reach out to us directly. And they don't need a doctor's referral to get started. They can self-refer to the email address here. So this is a helpful resource as well about information sharing with family members. This was created by Forest, or Facing Our Risk of Cancer Empowered. If you're not familiar, they are an education and advocacy organization for hereditary cancer conditions based in the US. You can scan that QR code if you'd like to pull up this resource. They have quite a lot of information and resources about hereditary cancer on their website, including this helpful booklet, which is about information sharing with relatives. They have pieces about who to share with and how, and that kind of thing. The Forest website can also be a really good resource if you're looking to clarify some of the information before talking with your relatives maybe, or to pass to them if they have some follow-up questions or want to learn more about hereditary cancer or the gene. It can be a good resource to pass on to them. Okay, so moving along to our main topic today, which is talking to children or young people about the gene. So we'll talk about the most common questions that come up, which are really around when to have that conversation and how to discuss hereditary cancer. I do want to just preface this whole discussion with a bit of a disclaimer. You know your kids and your relatives better than I do, so please do take all of this with a grain of salt. Tess often reminds us in this group to take what fits and leave what doesn't. So feel free to take that on today. So what I'm going to present today is a number of things to sort of consider, percolate on if you're thinking about having this conversation with the young person in your life, some research findings on this topic, but we won't leave with an exact step-by-step script or an exact timeline, but hopefully a few things to think on. Okay, so the first thing to consider about the timing is about your own readiness to have this conversation. So really sort of tuning into yourself and thinking about, have you come to terms with your result and do you feel ready to share this information with your child? So a few sort of clues to think about: do I feel calm when I think about BRCA 1 or 2? Or do I become agitated or anxious when I picture this conversation? So just sort of tuning in and reflecting for yourself. Why do we suggest this? One is, of course, for your own well-being. So if you're having challenges adapting to that result, there may be supports that can help. Inspire Health, that puts on this wonderful group, has one-on-one counseling available as one option. Or feel free to reach out to the Hereditary program and we can have a chat about what's going on and try to help connect you with appropriate resources. But also related to our topic today is really that kids can pick up on those emotions that they're sensing from you. So if they're sensing a lot of fear, a lot of strong emotions on their first introduction to this topic, that can be a signal to them that this is something to be a bit fearful of. So just having a think about that readiness. Some of you may be familiar with Dr. Karen Hurley, who's put on a great webinar in this series already. And she has a webinar online about speaking with kids about this topic, which is great. And I'll link at the end so you can watch that. And she talks about putting on your own oxygen mask before helping others. So thinking about making sure you're ready and set up and really best equipped to then offer that support to your child or other person in your life. So one note is that this doesn't mean you need to totally withhold or hide your emotions completely. And if you do become teary or upset during this conversation, that's okay and normal. Just something to acknowledge and also give some reassurance that emotions won't last forever. It's okay to have big emotions related to this and sort of talk about it openly. A few other considerations around the timing. Developmental stage and personality will play a role, and we'll talk a little bit more about the developmental stage in a few minutes. In terms of personality, thinking about, is your child a really curious young person? Are they a worrier? Are they very observant about what's going on around them? That might impact sort of what they're picking up about hereditary cancer in the family already, which goes on to our next point about considering the context. So for children that are seeing the impact of hereditary cancer around them, it can be really helpful and actually important to explain why that is or what's happening to help them make sense of things, because often their imagination may actually be worse than the reality. So if this is the situation in your family, something to consider, and those time points can sort of present an opportunity for a discussion to fill in some of those gaps. So things like a recent diagnosis or a loss in the family, if they're noticing a family member going for preventative surgeries or a lot of extra screening appointments, explaining a little bit more about what that's about can help them sort of make sense of things and fill in some of those gaps. So the sharing can be gradual, and in fact, that is suggested to sort of start this conversation and leave the door open for more conversations over time to sort of fill in information as a young person gets older, as questions come up, that kind of thing. And with all that said, there's not really a specific age that is the right age that's recommended for these conversations. It will vary depending on the young person and the family circumstances. But a few practical considerations about the testing and the timing. So just from the medical or the sort of practical side of things. So genetic testing for BRCA 1 and 2 is typically offered from around age 19 or the age of majority in BC. The main reason for that is that cancer risks in adolescence and young adulthood are negligible or not considered to be increased compared to people the same age. So there are no medical implications in childhood or adolescence, and their care will not change based on the test results. So for this reason, testing is typically offered from the age of majority to promote autonomy or to promote that young person making an informed choice about the testing for themselves. If your teen really wants to know and have their genetic test before 19, this can be explored. So the door to having a genetic test is not completely closed. You can reach out to us to discuss further. The main goal really is not to put up a barrier to the test, but to ensure a thoughtful process to make sure we're having a good conversation with them and you about the implications of the testing and just having a good, thoughtful discussion. That might be different from information you've heard before. You may have heard before that testing was not available before 19. And I would say that this is something that has sort of changed and evolved over time in terms of the comfort level from healthcare providers and healthcare institutions to provide this kind of testing to minors. So that's shifted a little bit over time. But keeping in mind that even if they have a genetic test at 15 or 16, and test positive for the gene mutation, the screening won't necessarily start at that time. So the youngest age that screening is typically recommended is for female BRCA1 and 2 carriers from age 25. And for male BRCA1 and 2 carriers, that would be from 35. So unless there's a really young diagnosis of cancer in the family, this might look a little bit differently, but in general, 25 is sort of the young end of the spectrum of when the screening would start. So just something to keep in mind, that if they did have a genetic test and found out it was positive, they may still be in a little bit of a holding pattern while waiting to sort of take action and actually start the screening. Another question that comes up around the timing of information sharing and genetic testing. Some people express concerns about implications for their child's eligibility for insurance. So just a quick note about that. The Genetic Non-Discrimination Act was passed in Canada in 2017. And that is a law that says that insurance providers cannot request or require disclosure of genetic test results as part of a new insurance application or a new contract. All right, with those practical pieces out of the way, let's talk a little bit about what the research shows about young people's preferences for communication. And this may surprise you a little bit. So I often hear from parents that they want to protect their children from this potentially distressing information and are quite concerned about sharing information too early. But when young people are asked about their preferences, they often say they would like to know more and earlier. So there's a bit of a mismatch between the perspectives of parents and children on the topic. So this was a study that was performed. They performed interviews with 34 mature minors that knew about genetic risk information but had not had a genetic test yet. And when they were asked if other families should disclose genetic risk information, all of the young people said yes, and all who responded said that they were happy that their parents told them. In this study, none of the respondents said that their parents gave them too much information. And they also asked for perspectives of parents and genetic counselors in this study. And here's just a quote from one of the young people that participated in the study. They said, "Even at 9, I knew, and I think it helped I knew, because instead of worrying, wondering, like if she took a pill or like a shot or something, I knew why. Before that, I was kind of wondering, like, why? Why do you do that?" So again, sort of going back to that idea of filling in the blanks with their imagination. So another study, which was a systematic review putting together the results of 15 studies. So a systematic review, meaning that they pool the results of a whole bunch of studies on the topic. And this was looking at children's experience of hereditary cancer risk communication. So in this whole pooled result, teens that were asked said they value knowing from a young age. In 6 of those 15 studies, children said that they wished their parents had told them more. And another important topic was around revisiting the topic over time. So sort of thinking about starting that conversation maybe early on. And that doesn't have to be the one-time discussion of a whole lot of information, but sort of revisiting over time as things come up or as questions come up. So a few more quotes. This one from one of the genetic counselors that was interviewed. They said, "I think providing age-targeted information can be helpful. As long as you set the stage early enough, at each point you bring the information in, it's not going to be blindsiding them, but they're just getting a bit more, a few more pieces to the puzzle so that they can comprehend the whole picture." And one of the young people says, "I knew that my mom had it because it was genetic, but I didn't know there was a risk that we would also have it. But they kind of shared that information as we went on, and I'm glad they did that. I think if they had told me everything all at once, it would have been a lot for me." So, as parents who are probably concerned about your kids, probably why you've signed up to a webinar like this, it's common to want to control the flow of information, as I mentioned, protect your child from distressing information. Unfortunately, this is not always possible, and it can be more harmful if they find out about the hereditary cancer risk in another way. Oh, my lights just went out in the office. So just something to consider when we're thinking about the timing is that the longer we wait, there might be a chance of finding out some other way, which can lead to a sense that a secret has been kept from them, which can be more harmful and potentially impact trust. So for example, if they overhear a conversation or a snippet of a conversation, this can be confusing. They may notice an intense conversation that stops when they walk into their room. And those are situations where their imagination might actually be worse than hearing the information more directly. Other examples might be hearing it from somebody else, like another family member, or learning about genetics in school and sort of putting it together. And all of these situations can impact trust, which in general, the research tells us is worse than if the discussion were to be brought up more directly. All right, so moving on to the how. So if we've decided to go ahead with the conversation, the next thing to think about is how that's going to go. So again, developmental stage and personality will play a role, and I'm going to talk more about that on the next slide. A good gauge or a good starting point is to think about previous difficult conversations, what has worked well there, what maybe hasn't gone as well, or what would you do differently. So a good starting point to think about previous conversations. Having the conversation together or separate with other children. So all families are different. A few things to consider about that might be their closeness in age. Do they have a similar coping style to each other? Are they supports for each other? Having the conversation all together can help promote the feeling of openness in the family. Whereas in a situation where there may be a large age gap, or maybe they have quite different information needs, separate might make a little bit more sense in that situation. If you are considering telling them separately or staggering the timing, just something to consider if you think one will tell the others, or if you think there might be an impact of asking one of them to keep that held back from their siblings, is something to just think about there. In general, it's suggested when talking about hereditary cancer and cancer in general to try to avoid euphemisms or sort of vague language. So using correct terminology and sort of simple and straightforward, direct language is suggested. Okay, so we'll chat briefly about a few principles of childhood development that may help guide some conversations. So I'll briefly review a few sort of points to think about. I'm also going to link some resources at the end that'll have more depth on this topic, and also two of them include some sample question and answers for children of different age groups. So this is by no means a comprehensive guide, and of course there are always individual differences between kids of a similar age. So just a couple points to keep in mind. So for preschool age kids, this stage is really characterized by what we think of as egocentric thinking. So meaning their focus is really on how a situation impacts them. And they typically aren't able to see things from somebody else's perspective. They're really exploring and learning through play and may apply magical thinking or associative logic. So associative logic being where they connect to things that we know are unrelated, but become sort of associated in their mind. Maybe they happened close to the same time or are connected some other way. So for an example of how that might play out, if a child is noticing maybe that mom is sick, or maybe mom is more agitated or upset, they might connect that to themselves. wonder if they played a role in causing some of that. Maybe this happened because I didn't pick up my toys, that kind of thing. So it can be helpful to provide some basic information to reassure them about what's happening, clarify the reasons why, and maybe that it's not connected to anything that they've done. As mentioned, it's encouraged to try to use or try to avoid euphemisms. And so, for example, mom doesn't feel well or something like that might be vague or confusing. So just using more sort of direct language is a good guide. For elementary school age kids, visual learning can be increasingly useful. So pictures might be helpful to support a discussion. Thinking tends to be fairly concrete still at this stage. So focusing on tangible impacts to their life, especially in the short term, can be helpful to address. Kids in this age group often are really learning about fairness and can be quite focused on the importance of fairness. So it can be difficult to square that with things like a diagnosis of cancer or inheritance in the family, which can feel quite random and unfair. So just a flag to maybe think about. Moving into adolescence, which is really characterized more by identity development, which really by definition involves the young person moving away from the family unit more towards their peers. So a completely normal part of development for young people is to distance themselves a little bit from their parents. They may increasingly be seeking information out independently, maybe separate from their parents. So if this is something that's brought up, maybe checking in a little while after the discussion to check in and see, did you have a look online for anything there? Or did you find anything that you were wondering about that you weren't sure of? Because they may be looking up that information independently. They are increasingly thinking in abstract concepts and able to grasp things like inheritance or probability or risk. The reaction to this type of information can be impacted by many things, one of which being how focused or not focused they might be on the future. So for some teens, it's common for us to hear that they feel invincible. It's a time where engaging in risky behaviors can be a bit more common. So for somebody in that kind of stage, hereditary cancer risk may be something that feels quite far away and not something that's top of mind right now. Other teens may find this information more distressing if they're a little bit more in that sort of future-focused space of thinking about their next steps in their life, that kind of thing. So a couple just things to consider about what that conversation might be like. So going back to that systematic review study from earlier, a little bit more information about sort of the how to have the conversation and the preferences expressed by young people for that conversation, or the first conversation, I should say. In general, the researchers found that young people value hearing this information from somebody that they trust, and they really do view their parent as sort of that primary person to share this information with them. They found that openness and honesty were really appreciated by young people. So if we go back to our earlier discussion about that mismatch that we see between parents and teens. So for parents, a prime motivator is really about protecting their child from distress, from the distressing information, whereas the priority for young people seems to be about feeling included, feeling that they're trusted with this kind of important information. And so while that instinct for protection is really coming from a place of concern, it's a little bit in tension or a little bit at odds with the priorities of the young people that are participating in the research. So we could, consider shifting that thinking a little bit away from protecting and shielding the young person and sort of more towards entrusting them or putting a vote of confidence in them to participate in this important family conversation and to trust them to adapt to and integrate this information to what it means for them going forward. And then lastly, thinking about this conversation, in general, a sense of hope really helps us all adapt to difficult or distressing news. And so we can be open and honest about hereditary cancer risk and also communicate hope in that conversation. So while we don't want to sugarcoat the information or say everything's going to be perfectly fine, because there probably will be difficult things that come along with this information, but we can think about how we might incorporate hope into the discussion. So thinking about some of the things that you might hope for your young person. One being, if they haven't had a genetic test yet, there is a possibility that they don't carry the gene. So if a parent carries the gene, it's that 50-50 chance we mentioned at the start. Another thing that I am hopeful about is the ongoing research that will produce new and better options to manage the risk if they do have the gene. So for young people now, we're looking a ways into the future before this might be something that they are facing directly. And there's time for the development of new and better options for them. Another helpful frame to add hope is that many families have relatives that carry the gene that have not had cancer. And so that can be a helpful sort of concrete frame of reference to share. So for example, Aunt Carol has the gene, but she hasn't had cancer. And that's something sort of a bit more tangible in the family as well. So thinking about your own context or what you might add that you're hopeful about. So as we've been touching on already, sort of being guided by the questions that come up is a useful way to sort of gauge where your child's at. And encouraging those questions can really help foster that openness and create an ongoing conversation and an ongoing channel of communication. We recognize that inviting questions can be daunting. It can be a challenging topic to talk about. So just a few things to reassure you around that. One is that I don't know is an acceptable answer for a lot of questions, especially if followed up with, let's find out together, or we can look into that more. Some questions don't need an immediate answer. So if you want to think about it, that's okay. And just say, that's a great question. I think I need some time to think about it to make sure that that I, have a thoughtful answer for you and come back to it at a later time. And some questions are big and may not really have an answer. So being guided by questions, but recognizing that it may not always be possible to answer everything completely, and that's okay. So a few more points about the how. So we talked at the start about that importance of tone when we were talking about readiness. So kids can pick up on fear and discomfort. And if they're noticing a lot of discomfort, or they're noticing that this conversation is quite upsetting to their parent or the person that they're talking to, that could impact their willingness to come forward with their questions later on. So they don't want to upset you. So just something to consider can be a factor in thinking about that ongoing openness of the conversation. In general, in the research, there were not consistent preferences among young people about the specifics in terms of the setting of where the conversation happened, the formality of the discussion, those types of things. So that's really where your knowledge of the young person comes in and in your relationship there. In the research, there was also quite a wide variety of reactions described. So it wasn't a consistent sort of response from young people to this information. For some, they reported feeling really worried right when they found out, and then that sort of dissipated over time. And some for others, maybe that felt far away and it didn't really sink in at first and was sort of a bit more of a process. So there's quite a wide variety of how young people reacted to the information. So a few more quotes from the research. So this was one of the mature minors who said, my mom, when she first told us, she spoke very calmly and explained it in depth, and she didn't get too emotional about it, which helped us not immediately freak out and assume that the worst was going to happen. And then another of the mature minors says, I think they did a really good job of making me feel like it was something that was okay to talk about. And they made me feel like I was part of that conversation and that they wanted to explain it to me. All right, so putting this all sort of together, this is a helpful paper with practical suggestions for parents to share information about hereditary cancer risk. It is an academic paper, so a bit of a dense read, but they put together a step-by-step framework. And the authors of this paper also have some sample question and answers for kids of different age groups and a bit more depth on some of those developmental stages that we touched on briefly. So we'll go through their 5-step process just to put all of that together, and much of this will be review of some of the ideas we've talked about already today. So step 1, being working towards emotional and informational stability prior to disclosure. So really just about that readiness, both the emotional readiness and then also making sure you have some of those information points clarified that you might want to share. So again, thinking about allowing some time for adjustment to your own results. So if it's brand new, thinking about taking a bit of time with that for yourself. Clarifying the relevant information that you want to talk about and tuning into your emotional readiness. Step 2 is making a plan. So making a game plan for disclosure, ideally one that is known and supported by all caregivers. So things to consider are the timing when that conversation is going to happen, where is it going to happen, what information are you planning to share, and who will be there for the discussion. So a few practical points to think about. Number 3, answer what is asked rather than withhold or overload. So again, being guided by those questions that are coming up from the young person, responding as openly and honestly as possible. And the goal is really to create that open door for a future discussion and sort of communicating that openness so that that's sort of a signal that it's okay to come forward later on as well. Number 4, allow space for their reaction and assess their needs. So as we mentioned, there can be quite a wide variety of initial reactions to this kind of news. So allowing some space for that, assessing where they're at and sort of figuring out where to go next from there. A bit of a clue that might be helpful is thinking about how difficult conversations might have gone in the past is a bit of a guide of maybe what to expect or to help provide some context. Number 5, the last step is encouraging that open and ongoing dialogue. So as mentioned, answering questions openly can help support that process and that open door. The emotional readiness can also play in here, so communicating both with your words and also with the tone and with the sort of tenor of the conversation that it's okay to bring up later on. And then also just explicitly inviting those ongoing questions to keep that conversation going. All right, so a few takeaway messages, things to think about going forward. As we've mentioned already, the importance of that readiness. So really taking a moment for yourself and thinking about that. With the timing, young people express preference for earlier disclosure, which can encourage trust and openness in the relationship. And this seems to be fairly consistent in the research. Be guided by questions and keep the door open for those ongoing discussions. And as always, we encourage people to spread the word about hereditary cancer risk in their family. And on that note, one thing I wanted to let you know about is that the Hereditary Cancer Program is just starting and to offer a new process. called supported direct contact. So historically, as we've talked about today, we have really relied on individuals to spread the word in their family and let their relatives know about the gene, and then for those relatives to reach out to us to get started or to initiate the process of referral or accessing genetic testing. With this new process, this would involve a healthcare provider reaching out directly to at-risk relatives to tell them about the genetic risk and talk about options. So this is done with the permission of the person who has been through the clinic. So we're not contacting relatives at random without discussing it first with a family member that has had the genetic test. And this does rely on the person that is in contact with our service or has had a genetic test to provide that contact information to us for their relatives. So we're not accessing the relative's private information from other sources. For some people, they've said that this can take some of the burden off from being the sole bearer of the news with relatives. And we hope it can potentially reduce the steps needed for relatives to access the test. One thing I hear from people quite a lot is that, I've told my relatives about this information, they haven't taken action. So we hope this might be a bit of a bridge to reduce the barriers to connecting with our service. So if this is something that you would like to explore for your family, you can reach out to us. It's sort of just getting started, but we expect in the next little while that this will be an option. And with that, just a few resources I wanted to share. So I've got a bunch of QR codes here if you want to scan with your phone, and also the links there. So Facing Our Risk of Cancer Empowered or FORCE has another really useful booklet resource specifically about talking with children about BRCA, and that's linked there. The Quebec Breast Cancer Foundation has produced a range of videos on a lot of different topics, including speaking with children, speaking with relatives, as well as some testimonial videos from carriers that are sharing their perspectives and experiences. So you can check those out. Women's College Hospital they've done a few webinar series. They've got them all on YouTube for viewing later on, and a few of them are on specifically speaking with relatives about hereditary cancer, and they've got some on speaking with children as well. So you can check those out at the top link there. And then I mentioned Dr. Karen Hurley's webinar on this topic about sharing information with children, which is linked here. It's really excellent. I encourage you to check that out as well. And I can put these back up at the end as well. I mentioned the email tool for sharing genetic test results with your relatives. So that is linked here. And then this last resource is, I think, a really excellent one. It's called Parenting at a Challenging Time, which is mostly focused on parenting during a cancer diagnosis or during cancer treatment. But a lot of the ideas and a lot of the suggestions on that site will also apply for talking about hereditary cancer as well. They also have some more detailed information about those sort of developmental phases and tips for kids of different ages there as well. So that's a great one to check out if you're looking for more. And that's all I have for today. So really happy to take questions and talk some more. And here's my email. Also, feel free to reach out by email. Thank you so much.